Good evening. Today I want to talk about breast cancer, what it is, why it's important, and why early detection can truly save lives. Breast cancer affects about 1 in 8 women, which means almost everyone knows someone who's faced it. For me, this topic is deeply personal because my mom was diagnosed with breast cancer. I remember the day we found out. I was in the room with her when the doctor came in and told us that not only did she have breast cancer, but it had also metastasized to her brain. In that moment, everything felt heavy and unreal. We were scared, overwhelmed, and unsure of what would happen next. But from that moment on, my mom began the hardest fight of her life. She started treatment immediately, chemo scans, doctor appointments, the whole routine. It felt like our world had become doctor's offices, hospital waiting rooms, but even through all of that, she never gave up. She just recently finished chemotherapy and is still fighting every single day. Her strength is something that I admire more than anything. To understand why breast cancer is such a serious disease, it helps to know what it actually is. Breast cancer happens when abnormal cells in the breast begin to grow out of control. Some tumors are benign and not dangerous, but malignant tumors can spread to other parts of the body. When cancer spreads or metastasizes, that's when it becomes harder to treat. Like in my mom's case, when it moved to her brain. There are also a lot of different risk factors that can increase a chance of developing breast cancer. Some of them can't be changed, like age, genetics, and family history. Others involve lifestyle, such as alcohol use, weight, and physical activity. Hormonal factors also play a role. But having risk factors doesn't automatically mean someone will get cancer. It just means it's important to be aware. There are also several signs and symptoms to watch for. These can include a lump in the breast or underarm, changes in the breast size or shape, dimpling and puckering of the skin, nipple discharge, or persistent pain. These symptoms don't always mean cancer, but they should always be checked by a doctor. Early detection is one of the most important parts of fighting breast cancer. Self-exam, clinical exams, and especially mammograms can help catch cancer before it spreads. If something looks suspicious, doctors may use ultrasounds, MRIs, or biopsies to get a clearer diagnosis. My mom's experience showed me how crucial it is not to ignore symptoms and how to take screening seriously. Breast cancer isn't just one single disease. There are many types, like ductal, lobular, inflammatory, triple negative, and HER2 positive. It also stages from a 0 to a 4. Stage 4, which is metastatic breast cancer, means it has spread to the other parts of the body. That's the stage my mom was diagnosed with, and it's one of the hardest battles a person can face. Treatment depends on the type and stage. It may include surgery, chemotherapy, radiation, hormone therapy, targeted therapy, or immunotherapy. Many patients also need supportive care to help manage side effects and maintain quality of life. Breast cancer doesn't just affect the person who has it. It affects everyone around them. Families feel the stress, the uncertainty, and the hope that comes with every appointment and every piece of news. Watching my mom stay strong through everything has changed the way I think about life, health, and the importance of supporting the people we love. Even though we can't prevent all cases of breast cancer, there are ways to reduce risk, like staying active, keeping a healthy weight, limiting alcohol, and not smoking. Most importantly, screenings truly save lives. Early detection gives people more treatment options and better outcomes. To close this off, breast cancer is serious, but awareness and early detection can really make a difference. My mom's journey has shown me how important it is to pay attention to our bodies, support each other, and never ignore symptoms. I hope her story encourages others to take breast health seriously and to schedule their screenings. It's never too late. Thank you.